Today we'll be demonstrating manual muscle testing of the upper extremity. This will help us gain understanding of the patient's generalized weakness and guide to proper treatment. A grading scale of 0 to 5 will be used when manual muscle testing. A 0 out of 5 is absence of muscle contracting. A 1 out of 5 is the ability to produce muscle contraction without joint movement. A 2 out of 5 is muscle contraction caused by complete joint motion without resistance of gravity. A 3 out of 5 is muscle contraction with joint motion and with gravity. A 4 out of 5 is muscle contraction causing joint motion against gravity, withstanding moderate resistance to and isolation contraction, yielding against normal resistance. A 5 out of 5 is muscle contraction causing joint motion against gravity and maximal resistance to isolation contraction. When manual muscle testing, the patient will resist at point of contact upon clinician's cue, hold, don't let me move you. When performing, it's important to consider proper body mechanics and patient comfort. Pillows, towels, and foam blocks are various forms that may be used.
Supraspinatus. The action of this muscle is shoulder abduction. Place patient in seated position with shoulders slightly abducted and elbow flexed at 90 degrees. Apply pressure at elbow, trying to force patient into shoulder adduction.
Hold, don't let me move you. Relax.
Infraspinatus. The action of this muscle is shoulder external rotation and horizontal abduction. Place patient in seated position with elbow flexed at 90 degrees and hand in neutral position. Apply pressure at the lateral part of the wrist, trying to force patient into internal rotation.
Hold, don't let me move you. Relax.
Teres minor. The action of this muscle is shoulder external rotation and horizontal abduction. Place patient in seated position with shoulders slightly abducted and elbow flexed at 90 degrees. Apply pressure at the distal part of the forearm, trying to force patient into shoulder internal rotation.
Hold, don't let me move you. Relax.
Subscapularis. The action of this muscle is shoulder internal rotation. Place patient in seated position with arm by their side and elbow flexed at 90 degrees. Apply pressure on the medial part of the forearm, trying to force patient into shoulder external rotation.
Hold, don't let me move you. Relax.
Anterior deltoid. The action of this muscle is shoulder abduction, flexion, internal rotation, and horizontal adduction. Place patient in a seated position with shoulder abducted slightly and elbow flexed at 90 degrees. Apply pressure at the distal anterior surface of the humerus and try to force patient into adduction and extension.
Hold, don't let me move you.
Middle deltoid. Action of this muscle is shoulder abduction. Place patient in seated position with shoulder abducted and elbow flexed at 90 degrees. Apply pressure at the middle of the humerus, trying to force patient into shoulder adduction.
Hold, don't let me move you.
Posterior deltoid. Action of this muscle is shoulder abduction, extension, hyperextension, external rotation, and horizontal abduction. Place patient in seated position with shoulder abducted and elbow flexed at 90 degrees. Apply pressure at the distal posterior surface of the humerus and try to force patient into adduction and flexion.
Hold, don't let me move you.
Coracobrachialis. The action of this muscle is primarily to stabilize the shoulder joint, but also assists in adduction and flexion of the shoulder. To test this muscle, have the patient seated and place arm in 90 degrees of abduction while applying downward pressure to the distal end of the humerus.
Hold, don't let me move you. Relax.
Levator scapulae. The muscle action is elevation and downward rotation of the scapula. When testing, have patient sit in the seated position, arms at their sides, and place downward pressure just lateral to the superior angle of the scapula.
Hold, don't let me move you. Relax.
Upper trapezius. The action of this muscle is scapular elevation and upward rotation. When testing, the patient may be seated or lying in the prone position. If lying prone, have the patient slightly abduct extended arm and apply downward pressure proximal to the elbow. If patient is seated, apply downward pressure on the acromion process of the scapula.
Hold. Don't let me move you. Relax.
Long head of the biceps. Action of this muscle is elbow flexion. To test this muscle, place the arm into supination and straight out into 90 degrees of shoulder flexion. Apply pressure on distal forearm, pushing downward into extension.
Hold. Don't let me move you. Relax.
Short head of the biceps. Action of this muscle is elbow flexion and can be tested either sitting or lying supine. The patient will flex their elbow to 90 degrees with palm facing towards the shoulder. In a supinated position, with pressure applied to extend the elbow at the midpoint of the forearm.
Hold. Don't let me move you. Relax.
Brachioradialis. Muscle action is elbow flexion. To test, have the patient seated and flex the arm at the elbow to 90 degrees with the wrist in the neutral position and apply downward pressure at the distal radius of the forearm.
Hold. Don't let me move you. Relax.
Brachialis muscle. The muscle action is elbow flexion. When testing, the patient should be seated with arm flexed to 90 degrees at the elbow and the hand pronated. Then apply downward pressure at the midpoint of the forearm.
Hold. Don't let me move you. Relax.
Supinator. Action, forearm supination. To test this, have patient hold arm in front at a 90-degree angle with thumb facing up. Grab at the wrist and try to force the patient into pronation and don't let them move.
Okay. Hold and let me move you. Okay, relax.
Pronator teres. Action, forearm pronation and assistive in elbow flexion. To test this, have patient hold arm straight in a 90-degree angle with thumb facing up. Grab at the wrist and try to force the patient into supination. Hold and don't let them move.
Okay. Now hold and let me move you. Okay, relax.
Triceps. Action is elbow extension. To test this, have patient's elbow slightly flexed and apply pressure at wrist towards elbow flexion.
All right. Hold. Don't let me move you. Okay, now relax.
Upper trapezius. Action is scapular elevation and upward rotation. To test this muscle, have patient down in a prone position. Arms are in an A position. Thumbs up. Apply pressure down.
Go ahead and bring it up. Good. Hold. Don't let me move you. Good. Let go.
Next is middle trapezius. Action is scapular retraction. Place patient in prone position, arms out in a T with thumbs up. Apply pressure downward into scapular protraction.
Hold. Don't let me move you. And relax.
Lower trapezius. Action is scapular depression and upward rotation. Patient is in prone position. Arm is up in a Y position with thumb up. Apply pressure downward.
Hold. Don't let me move you. And relax.
Rhomboids. Action is scapular retraction, elevation, and downward rotation. Patient is in prone position. Arm is out in a T, and thumb is down. Apply pressure downwards into protraction.
Hold. Don't let me move you. And relax.
Latissimus dorsi. Shoulder extension, adduction, medial rotation, and hyperextension. Place patient in prone position. Arms by side, palm facing up. Apply light pressure downwards as the patient tries to resist into hyperextension.
Hold. Don't let me move you. And relax.
Teres major. Action is shoulder extension, adduction, and medial rotation. Place patient in prone position with arm behind back, palm facing up. Apply light pressure downward at the distal humerus.
Hold, don't let me move you. And relax.
Serratus anterior. Muscular action is scapular protraction and upward rotation. To test this muscle, have the patient lying in the supine position with the arm flexed to 90 degrees at the shoulder and elbow extended with the scapula of the shoulder held in protraction. Grab the patient's wrist and apply downward pressure. Hold, don't let me move you. And relax. Pectoralis major. Muscle action is shoulder adduction, medial rotation, and horizontal adduction. To test this muscle, have the patient lying supine with the arm flexed and horizontally abducted with a slight bend at the elbow. Apply downward pressure at the distal end of the humerus. Hold, don't let me move you. And relax. Pectoralis minor. Action is scapular depression, protraction, downward rotation, and tilt. To test this muscle, have your patient lie supine and protract the scapula while applying pressure to the anterior aspect of the shoulder in a downward motion. Hold, don't let me move you. And relax.
Extensor carpi radialis brevis. Action is wrist extension. To test this, have patient's forearm on table and slightly extend their wrist. Apply pressure at base of third metacarpal.
Okay. Now hold, don't let me move you. All right, now relax.
Extensor carpi radialis longus. Action, wrist extension, and radial deviation. To test this, have patient's forearm on table and slightly extend their wrist. Apply pressure at second metacarpal.
Hold, don't let me move you. Okay, relax.
Flexor carpi ulnaris. Its action is wrist flexion and ulnar deviation. To test this, have patient's arm straight with forearm and palm facing up. Stabilize at the elbow and have patient slightly flex wrist. Apply pressure on the fifth metacarpal, pushing towards wrist extension.
Hold, don't let me move you. Okay, relax.
Flexor carpi radialis. Its action is wrist flexion and radial deviation. To test this, have patient's arm straight with forearm and palm facing up. Stabilize at the elbow and have patient slightly flex wrist. Apply pressure on the first metacarpal, pushing towards wrist extension.
Hold, don't let me move you. Okay, relax.
Flexor digitorum superficialis. Its action is finger flexion of MCP and PIP joints. To test this, stabilize the MCP joint and have the middle phalanx slightly flexed, and put pressure on the middle phalanx towards its neutral position.
Now hold, don't let me move you. Okay, relax.
Flexor digitorum profundus. Action is finger flexion of MCP, PIP, DIP joints. To test this, stabilize the PIP joint and have the distal phalanx slightly flexed. Apply pressure at the distal phalanx towards its neutral position.
Now hold, don't let me move you. Relax.
Extensor digitorum. Action is finger extension of all three joints, MCP, PIP, and DIP. To test this muscle, you will place the patient's arm on a table in a neutral position with fingers in slight flexion. Apply pressure to MCP joint either collectively or in groups.
Hold, don't let me move you. Relax.
Lumbricals. Action is finger flexion of the MCP joint while extending the PIP and DIP joints. To test this muscle, you will need a piece of paper, and you will put the patient's arm supine on a table and instruct the patient to hold the paper tight and don't let go.
Hold, don't let me pull this paper out. And relax.
Dorsal interossi. Action is finger abduction at the MCP joint. To test this muscle, you will place the patient's arm on a table and hold their fingers together while instructing them to try and separate their fingers.
Okay, try to spread your fingers and relax.
Palmar interossi. Action is finger adduction at the MCP joint. To test this muscle, have the patient rest their arm on a table and place your fingers between theirs and instruct them to hold you and not let you get away.
Okay, hold my fingers and don't let me escape. And relax.
Adductor pollicis. Action, thumb adduction at the CMC joint. To test this muscle, you will rest the patient's arm on a table with their thumb in a neutral position. Apply pressure to the inside of the first metacarpal while trying to abduct the thumb.
Okay, hold, don't let me move you. And relax.
Opponent's pollicis. Action, thumb opposition at CMC joint. To test this muscle, rest the patient's arm in supination on a table. Instruct them to bring their thumb and pinky together while trying to separate them.
Okay, hold, don't let me move you. And relax.
Abductor pollicis brevis. Action is thumb abduction at the CMC joint. To test this muscle, place the patient's arm on the table, thumb facing up. Stabilize the metacarpals at the wrist and apply pressure to the proximal phalanx.
Okay, hold, don't let me move you. And relax.
Abductor pollicis longus. Action is thumb abduction at the CMC joint. To test this muscle, you will place the patient's arm on a table, thumb facing up. Stabilize their wrist while applying pressure to the metacarpal of the thumb while trying to move it into abduction.
Okay, hold, don't let me move you. And relax.
Flexor pollicis longus. This muscle flexes all three joints of the thumb, IP, MCP, and CMC. Stabilize the CMC and MCP joint of the thumb, applying pressure to the distal phalange, forcing it into extension.
Don't let me move you. Relax.
Flexor pollicis brevis. This muscle flexes the MCP and CMC joints of the thumb. Stabilize the first CMC joint and apply pressure to the proximal phalange, forcing the thumb into extension.
Hold, don't let me move you. Relax.
Extensor pollicis longus. This muscle extends all three joints of the thumb, IP, MCP, and CMC. Stabilize the CMC and MCP joints of the thumb, applying pressure to the distal phalange of the thumb, forcing it into flexion.
Some extension. Hold, don't let me move you. Relax.
Extensor pollicis brevis. This muscle extends the MCP and CMC joints of the thumb. Stabilize the first CMC joint and apply pressure to the proximal phalange of the thumb, forcing it into flexion.
Thumb into extension. Hold, don't let me move you. Relax.
Opponens digiti minimi. This muscle opposes the fifth finger at the CMC joint. Bring the thumb and the pinky together and try to pull the two fingers apart.
Don't let me move you. Relax.